Hello, welcome to the lecturer's desk. Get your medical thoughts cleared before you leave. And please don't forget to subscribe to the YouTube channel and turn on the notification bell.
Hello guys, welcome back once again to my YouTube channel. My name is Mike, you can call me Mike. Please, if you are new here, kindly subscribe to the channel and turn on the notification bell. If you are old here too, please get yourself a desk and let us get started. Today we are going to talk about extrinsic cardiac conduction. We've already talked about the intrinsic one, that is the ability of the heart to generate its own electrical impulse and then transmit it throughout the heart. Today I'm going to talk about the intervention of the autonomic nervous system in the control of increasing and decreasing of what the heart rate, which is being what generated by what the intrinsic what process, which is 60 to 80 heartbeat per 1 minute. Is either we increase it or decrease it when there's what an intervention of the autonomic nervous system. Now, the autonomic nervous system is made up of, or is having two main pathways. Now, it has the sympathetic and then the parasympathetic one. The autonomic nervous system, it has two main pathways. It has the sympathetic one and then the parasympathetic pathway. Now, the sympathetic one is actually what increases the heart rate, and then the parasympathetic one is what decreases the heart rate. Now, today we are going to go into details, the processes involved in what in increasing the heart rate and then decreasing of what the heart rate. Now, for you to remember, the sympathetic one, we normally say it is a part of the autonomic nervous system that intervenes when there's an emergency. For example, when you see something, you are afraid of it and want to run, you understand, the heart needs to pump blood at a faster rate, and because of that, there's what an intervention of the sympathetic one. And then when you are resting, there's what intervention of the parasympathetic one. So don't forget that one. Now, when you come to the heart has the cells of the heart, they have receptors. You understand? Receptors. The receptors are like gates through which a certain signals can reach the cell. So without these receptors, when there's a signal and the signal is not having any receptor on the cell, it cannot enter the cell. You understand? Now, so this sympathetic and parasympathetic pathway, they have receptors in the cardiac muscle cells. You understand? When you take the parasympathetic one, it has its own on the sinus node and then the AV node, but the sympathetic one, everywhere you can get it. Now, let me take small parts, one cell of the heart, and then magnify it over here. So imagine this part of the cell, and that one is what I have magnified over here. So you are going into detail what happens in there. Now, when there is what stimulation of sympathetic one, what happens is the sympathetic nerves liberate neurotransmitters, and these neurotransmitters, what they do is they have affinity for the receptors. Do you understand? They have receptors over here. So for the sympathetic nerve over here, they will release epinephrine and then no epinephrine. Do you understand? And then this epinephrine and no epinephrine, they have their receptors in here, which is called the beta 1 adrenergic receptors. So this beta 1 adrenergic receptor, when it gets what stimulated, or when it gets stimulated by the epinephrine and the no epinephrine, what it will do is it will activate certain protein, which is the gene. Let me put it this way, which is a gene S protein, which is gene stimulating protein. Do you understand? And this protein, what is that? Is on its normal state without the stimulation of the beta 1 receptor, what happens is it will be uniting with what? GDP. So when it stimulates it, it liberates this GDP and then unite with GTP. When it unites the GTP, what will happen is it will come and activate one enzyme located on the membrane. Do you understand? And this enzyme is what we call the adenyl cyclase. Do you understand? I've written it AC shortcut from adenyl cyclase. And this adenyl cyclase, what happens is it converts ATP to cyclase AMP. And what is the importance of this? This cyclase AMP is like a factor that activates one specific protein. You understand? Or one specific enzyme, which is called what? Which is what? The protein kinase A. PKA. Let me write it short away. The protein kinase A. And this protein kinase A, it has ability of what? Phosphorylating the sodium channels and then the calcium channels. Well, we know the sodium channels is what? The friendly channels, and then the calcium channels, when there is what? When they open and there is what? Movement of sodium and then the calcium inside the cell. Do you understand? What happens is there will be what? More depolarization. And as there's more depolarization, the cell tends what? To beat at a faster rate. Do you understand? So this protein, what it will come here, it will phosphorylate the calcium, the L-type calcium channel, and then the L-type sodium channel. And then there will be what? More influx of calcium and then the sodium. As there's more influx of calcium and sodium, what happens? There's what? More increase of what? Action potential. The action potentials increases. And as action potentials increases, the heart rate does what? The heart rate also increases. And as the heart rate increases, our cardiac output also, let me do it that way. Our cardiac output also does what? Increases. And as our cardiac output increases, we increases what? The blood pressure of the person. Do you understand? The blood pressure of the person, that's what also increases. And this increase in heart rate is what we call it like tachycardia. So you see tachycardia anywhere is an increase in what? The number of rates from the normal one. When the heart beats more than its normal, which is what? The 80. Do you understand? It's what we call what? The tachycardia. Now, let's come to the parasympathetic one. So this is actually the sympathetic one. What the process involved in that. Let's come to the parasympathetic one. The parasympathetic one, what happens? When there's what? A liberation of the neurotransmitters into the receptors of the parasympathetic neurotransmitters. What happens is it also undergoes series of processes, and I'll be explaining that. Now, you see, we have this nerve, which is the vagus nerve. The vagus nerve, through this vagus nerve, that's where we get what? The releasing or the liberation of our parasympathetic neurotransmitters. Okay, do you understand? And this is what we call what? The acetylcholine. The acetylcholine is the neurotransmitter for the parasympathetic one. And when you release the acetylcholine also has an ability for a certain receptor over here, which is what? The muscarinic receptor, which is the M2. You understand? Okay, now the M2, when the acetylcholine unite with the receptor, which is the M2, what it will happen is it will also activate a certain protein. This one was what? GS, right? So this one is also GI, for you to remember. This is what? Gene stimulating protein, and this is what? Gene inhibitory protein. You understand? So this protein, they are in the form of like inhibiting what? The work done by what? Certain enzymes what? In the cell. Now, let's take this protein. This protein is like having three main components. It's having what? An alpha. It's having beta, and it's having what? Gamma. See, alpha, beta, gamma. Now, when the M2 receptor gets the stimulation from the acetylcholine, it will stimulate this GI, and then the GI protein, what it will happen is it will separate the alpha part from the rest. Do you understand? It will separate the alpha from the rest. And when it separates the alpha from the rest, what is this going to do? The beta and then the gamma, what they will do is they will come to the inferior part. Let me say this way. They will come this way and then stimulate potassium channels. You understand? And these potassium channels, when they stimulate it, it will cause it to open. And when it opens, there will be what? More movement of potassium outside the cell. You understand? And as potassium comes out of the cell, it will create more room for what? Electronegative. Do you understand? The cell becomes what? More negative. And because of that, it will bring the cell to what? Hyperpolarization. When there's what? When there's a hyperpolarization, that means the cell is more negative in such a way that before it gets itself stimulated or gets itself depolarized, it needs more positive ions. So it will take time before the cell can what? Generate one action potential. Do you understand? And because of that, it will reduce what? The rate in which the heart beats. So instead of the heart beating the 60 to 80, it will rather decrease from 60 to maybe 50, 55, maybe 40. Do you understand? Depending on what? How strong the stimulation is. Now, second, the alpha part. The alpha part, what it does is, it also come here and inhibit the adenyl cyclase. The adenyl cyclase will be what? Inhibited by what? The alpha part. And when the alpha part inhibits the adenyl cyclase, what will happen is we cannot what? Convert the ATP to cyclase AMP to activate the protein kinase R, and then we stimulate what? The sodium and then the calcium channels. So what will happen is this process is going to be what? Inhibited, so that you won't get what? More sodium and the calcium coming inside. You understand? And then this channel will also send in what? Potassium outside, and to create more room for what? For electronegative what? Ions, which will send the cell to what? Hyperpolarization. And when the cell reaches hyperpolarization, it will need more stimulation. You understand? More positive ion to enter the cell before it can what? Generate another action potential to be transmitted. And because of that, the rate of the heartbeat also, that's what decreases from the 60 to downward. So this is basically what the extrinsic conduction system does. It increases and decreases the activity of the heart. Do you understand? And what activity? The pumping of what? Generation of the action potential, so that you can get the muscle cells excited to contract to send blood. Do you understand? And this term is what we call the decreasing in the heart rate, is what we call what? The bradycardia. The bradycardia. The bradycardia. And then an increasing one is called what? The tachycardia. Do you understand? So this is basically what is it? The sympathetic and then the parasympathetic. Sympathetic increases, parasympathetic what? Decreases. Sympathetic is what? Emergency. Parasympathetic is when you are at rest. Do you understand? And these are what? The process that you go through. Please, this brings us to the end of today's what? Lesson. If you have, or if you find this lesson interesting, please, you can subscribe to the channel and then turn on the notification bell, so that you wait as we upload more videos, you'll be the first person to watch them. Thank you for staying with us till this time. See you in our next video.